Hello.
How are you? Are you using your mobile phone?
Yeah, is it should be changed like that?
Okay, better like that. Thank you.
Okay. Sorry about that.
So, I see you are in a great crisis right now. Can I help you?
Um, I have been denied a family doctor since 2016. Um, there are 7,000 people waiting in my city. Um, I have fought for 5 years trying to hold the government accountable, get healthcare. I've contacted everyone possible, and I decided to. I wasn't like if I failed, I could not get anything. I decided to apply to be euthanized, and
Apply to. Sorry.
euthanization. I was going to
Oh,
be applied to be euthanized, and you need a family doctor for that too. And so I have told all my family, everyone in my life knows that I'm suicidal because I can't get health care and I'm being treated like a monster in this country. People with autism in North America are associated to all of the school shootings, and there are a lot of horrible events that happen in North America, and the criminal justice system uses autism as a defense, and through association to those criminal activity, people with autism are treated like threats and like monsters. And I've been dehumanized here by the system. I have people that love me, like I have people that, but it's the system that doesn't treat me right. It's the things that I need to stay alive. It's my employer. It's my insurance company. It's my doctors. I can't get a lawyer. I've represented myself in law. Like I've taken everything to court on my own, and they just starved me. They put paperwork on top of paperwork, and it gets nowhere. I still don't have a doctor. They don't help. They just call the police on me when I tell them that I want to die instead of getting me a doctor. And I've had the police at my door all month, and I've wanted to die all year basically, and I tried to be euthanized, but they don't allow that because I don't have a doctor and I can't get one. And then some close people in my life told me to leave the country, and so I booked a flight and I sold my car. I sold my everything that I have to. I sold all my plants, everything that makes me happy. I got rid of. I put stuff in a storage unit that I would take to Portugal, which isn't a lot. I have 5 suitcases, and I went to board my airplane on November 29th, and the airport here told me that I was not allowed to get on the plane because I had the wrong negative test. I looked at my Portugal requirements. They said that I needed a negative antigen or a negative PCR. I went to go get my antigen, which was $40. Came negative. It's done within the time frame. I go to get on my plane, and they don't let me on my plane. I had a meltdown. If my friend wasn't there, I probably would have jumped off the closest bridge after that. I've been extremely suicidal. I feel like I've been held hostage. I feel like they're raping me with this vaccine. I don't want it. I have my mom and my grandma both have active aneurysms. My grandmother has had severe blood clots without vaccines. I'm autistic and I have high risk of strokes at 30 years old, and I've had a lot of trauma already. So I already have a lot of circulation issues, and I smoke like a chimney because I want to die. I would love to be happy and not smoke, but it says on the package it can kill you, and I'm pretty logical. I'm not smoking because I want to live, and I feel like I have no voice here, And I contacted everyone for the whole month. The last 3 weeks, I have contacted 35 psychologists. None of them will see me. They all ignore me. In fact, it's so weird because, like, how I get treated in Portugal is why, like, I was in Portugal for 3 weeks. Somebody paid for me to go visit, and I couldn't believe how people were. They embraced my autism, and, like, I know nowhere is perfect, but, like, people didn't back away from me when I told them that I was autistic. They, like, leaned in and were interested. And I was able to get 2 appointments with you, and I don't know if you've talked to Pedro at all, but Pedro was supposed to see me today in Portugal. I was supposed to be in Portugal today because he specializes with autism in adults, and that is something that we don't have in Canada. And I exhausted every single autism resource for people with autism in this country, and somebody finally said that they can't serve me because I'm over 18 and the government doesn't provide funding for anyone over 18. So I'm like, it doesn't, just no services help me. And the fact that I'm able to get an appointment so quickly is really one of the reasons why I'm moving, is because I'm at the end of my life now where I don't have any more strengths. I have nothing. I can't. Like, I'm actually, like, I didn't think I was going to make it to the 29th. And, I have my suicide all planned out. I have all of my family knows about it. I have my will. I'm ready. If I can't get out of this country, I don't want to be here. I can't survive this tyranny. I can't survive not having a voice. I can't survive being told that I'm being punished for something that will put my life at risk, higher risk. And I need a vaccine exemption, and no doctor will do that here. I have gone to 3 hospitals. I have had the police at my door all month. They have taken me to the hospital, and no doctor will provide me a vaccine exemption, even though I have, like, medical. I'm moving permanently. And this is a medical emergency, and you guys don't require the vaccines as of yet, but I still need this exemption because I'll never take this vaccine for a flu. I'm also Native American. I was raised with different treatment methods, and I have been actually, like, I had the flu first. I was, like, one of the first people to get it back in January 2020. I was actually in Portugal when I got it, and as soon as I found out that there was an unidentified virus, I created everything that my grandmother taught me. I set the alarm. I was, like, one of the first people in Canada to be like, everybody watch out, this is the flu of the century. And everybody just called me crazy and paranoid. And then it changes the world, and people push me back even further. And I've been isolated this entire 2 years. And it's just been really hard. And I did everything I could to, provide treatment options for people that my grandmother has passed down to me, and I prefer that method over doing the vaccine as well. So, like, religiously, and for the fact that I'm moving because of a vaccine exemption, or for medical attention, sorry. And then my grandmother and my mom both have active aneurysms. My grandmother was put on blood thinners once because of a blood clot, and the nurse station, she lives up north in a very, very isolated area, they only have, like, a nurse that comes in every Wednesday, and she misread her thing, and my grandmother had to get airlifted because her blood turned into water, and she had to get a blood transfusion. Like, there's serious circulation and blood clot issues in my whole family, and I'm not going to increase my risks for that. So just blatantly forcing this on every single person is unethical by all means whatsoever. And there are people that develop circulation issues after this, and I don't want to increase my risks. And I shouldn't have to. And I've already had this virus, but because Canada prevented people from accessing antibody tests for 10 months, so January 2020 I had the infection. I tried to warn everybody at the end of January. I asked for an antibody test. They won't give me one. I asked for a test in March. They won't give me one. Asked for a test in June. They won't give me one. I'm thinking, okay, there's not going to be anything detected. October 2020, 10 months later, they finally offer tests for antibody things. And I go in and it's negative, so there's no antibodies left in my body. Now I'm being forced to take a vaccine. Meanwhile, I have the proof of that antibody test as well, but it's like, negative. And I documented everything from the very beginning as well. And I've just been provided no voice. No doctor will sign it. I don't have a family doctor, and the family doctors are the only ones that are doing it. The College of Physicians and Surgeons of Ontario are currently suing 4 doctors in Ontario for giving out exemptions. So the system here is actually intimidating doctors from giving out exemptions. So there's even more fear in the medical professions to provide vaccine exemptions, and they're forcing people like me into this situation. So I have no way out. I exhausted everything that I could possibly do. I don't even know what you can do, but the Transport Canada is the one that made this rule, and they have exemptions. All I need is a doctor that I've had an appointment with or a nurse practitioner to be able to sign off on this exemption. And it's, I'm flying to Portugal Air, and I will do anything. Like if I have to isolate myself for 14 days under quarantine, like I will. Like I'm not like there is nothing that I want to do to cause harm on like anyone. Not here, not there. There's nothing about this that is selfish or, I just need to live in a place that I feel safe, that I can get access to healthcare for me specifically, with people that are trained with autism, because there's nothing here, and all of the training that I had in autism before, and everybody that is autistic here, you get trained on how to erase your autism. They don't, they do not embrace it. All of the medical attention that you get in this country currently, as it stands, is conversion therapy. They try to therapy your autism out, and they give you all of these coping mechanisms and strategies to hide your autism. And if you're not able to hide your autism by the time you reach 18, they don't care about you. And you're demonized, and you're treated less than. And there's like no resuscitation orders for people with autism. And like I would never even go to the hospital in this country if I had autism, because they wouldn't even let me live. They would literally choose for me to die because of my autism. And I don't trust the healthcare system because of this, And I need out of this country. And I don't know what else to do.
I need some enlightenment here because I don't know the legislation in Canada. You can go into Portugal without vaccination. The problem is that you can get out of Canada without vaccination.
I can't get on a plane, train, or any form of public transportation without a vaccine record or a vaccine exemption. And I have a letter from my member of parliament. I have it I have it somewhere, and it says that any appointment with a doctor or nurse practitioner, it doesn't even have to be a doctor, it can be a nurse practitioner, who can provide me an exemption, and there are 5 ways to get an exemption. 1, if I'm traveling for medical purposes. 2 is for religion. 3 is for health history. And people are getting exemptions except for me. There are people that are getting these vaccine exemptions here, but I don't have access to a family doctor. And the only ones that are comfortable doing this here are people who have existing relationships with doctors. And I don't have that. And I've tried. I've gone to hospitals. I've gone to the emergency room. I've gone to walk-in clinics. I've gone to urgent care facilities. I even went knocking down dentist doors, and I went to a pharmacist, and like I've even gone on like online websites and like asked people to like get me in to see their doctor, and nobody is helping. Like no one. So I have exhausted my effort to get out of this country.
How old are you? Sorry?
36. I'm 36.
When did you have your autism diagnosis?
In university. so it was late. But I had other diagnoses before that. I used to have a doctor, but she retired. Her name was Dr. McDowell. She diagnosed me first with ADHD and mood disorders and adjustment disorder, because I've had a lot of trauma and severe CPTSD. And then in university, which was when I was from 27 to 33, so I went much later in life. In my third year of university, I had a meltdown, and the doctors there were more familiar with autism, and they were able to diagnose me and to put me on a different path as opposed to the ADHD. So since university, I've had these coping mechanisms, but then when I came out about my autism, I was like, hey, look, I'm not attention deficit. I'm actually autistic. I immediately became less than human. Immediately, like overnight, people drew away from me here. There was a rumor that went around at university as soon as I told everybody that they need to step away from me because I might snap one day and come into the school and shoot everybody. And that was actually a rumor that went around my university about me, and people like backed away from me because of my autism. And immediately, I felt dehumanized because of my disability. And for a number of years after that, I wore my autism like a badge, and everywhere I went, I tried to prove to other people that it's not a bad thing, and all I got was pushed further and further away from people and more isolated, to a point where nobody even checks on me anymore. Like, if I died, my body, it would take days before somebody found my body.
What courses did you take in university?
I got my landscape architecture degree.
Okay.
So I'm very qualified to work. Like, I would be willing to do anything to work in Portugal, like telecommunications. I've done telecommunications. I've done bank work. I've done so many things to get where I am. I've had a really hard life. My mom is Native, and it's really hard for Native people here. And I'm white passing because of my dad, but my mom had it really bad. And they tried to take me away from her, the system, multiple times. And the system made my mom's life extremely difficult. And she almost killed herself multiple times too. And I was homeless by the time I was 15, living in a park on a blanket by the time I was 15 years old. And I made it this far, so I'm proud of myself.
Yeah, so I understand you're very tired. It's been 5 years now since you're fighting to have access to health care. At the same time, it seems to me that you have a lot of good things. You mentioned friends. You mentioned your education. You just mentioned that you're proud of yourself. I know and I understand, and I'm sorry to ask you this because sometimes it's almost offensive, but I would like to ask you to be even more resilient. I think you've been resilient with all the story. You lived a very hard life. Don't quit right now. And please, if you have friends...
Can you get me a vaccine exemption?
I think, for what you are telling me, that it needs to be a doctor. I'm not a doctor. I'm a psychologist. At least in Portugal, there is huge differences. We are treated.
Do you know any doctors there? Do you know any doctors there?
In this association that you contact, this Portuguese Association for Autism, we have a psychiatrist also. Okay. Maybe I can talk to him. I'm so sorry, Sandra, but I'm buying the helium tank today, and I'm going to be gone before the end of the year if I can't get out of this country. There's nothing going to stop me. I've already sold my whole life off. I cannot survive here. I've already
everything's done to leave. If I can't, like, all of my suitcases are still packed, and I'm gonna die with them. I'm gonna be dying with these suitcases. I'm gonna be sharing all of the videos, how hard I tried to get out of here. And this, hopefully, maybe I've died for everybody's freedom, but I'm not gonna quit dying. This is my mission now, to get out of this world. If I can't get out of this country, if I feel held hostage, I can't survive this. This is not acceptable. This is the most unethical thing I've ever experienced in my life, and
I'm not saying it isn't, but I'm afraid that this is not going to change the system. This is going to change a lot your system, your friends.
It doesn't
your
matter.
Family.
My family already knows. Everybody in my life has already accepted my death. Everyone. I've already got a will, an executor, and somebody to carry my ashes. Everybody that I know is prepared for this. I'm not.
I think it's a huge waste, Aaron. You're so resilient. You just make it till 36 years with all this story of abuse and negligence, being homeless.
It's okay, Sandra.
In Canada, do you have this difference between psychiatrists and psychologists also? Do you understand that a psychiatrist, he has medicine first, and then it's a specialty? Okay?
I just need a nurse practitioner. It doesn't even have to be a doc. I just need somebody to give me this exemption to get on a plane, and it's okay. It's okay. It's okay.
Can you send me the document which has to be signed? And I will ask our psychiatrist if he can see you. If as you didn't, you weren't so sick. You had trouble in paying this consultation, and for you not to have to pay for 2 consultations, you would only pay for the consultation with him.
I don't care how much it costs. This is my freedom. This is my life. My life is priceless.
Send me the form.
There isn't even a form. It's like the government wasn't even prepared for this. It's so unethical, and there's nobody trained. Nobody knows what to do. I can look for the forms again right now. Last time I looked.
You can do it after we talk. Can we do it so this time? But you send me a link after we talk. Can it be?
Yes.
And what I would like to tell you is to tell you a bit more about autism in Portugal and about healthcare in Portugal. Some things you said, I see that they happen in Portugal also. We have a national health system which has good services, pediatric services for neurodevelopmental disorders, but we don't have good adult services on the national system, okay? So we only have people who are experienced in autism, in adult autism, but that work in private practice, because this association that you contact is a private one. That's why
That's okay though. I don't even have that here. They don't even have that here. That doesn't exist here.
Not even
private.
Practice. Okay.
It's terrible. I've called every single one. Autism Canada, Autism Ontario, Autism Services, there's Red Path. All of these places only help kids. They only help kids. And there's 70,000 kids on the wait list at Ontario.
Okay. In regard to work, to employment, for instance, talking to you, you are pretty much adequate in communicating and interacting. So I wouldn't say at first glance that I wouldn't notice your autism at the first glance. So what I would tell you is don't tell the employers that you have an autism, because in Portugal they do not. They are still afraid that the person is not going to be. there are two types: the ones that expect you to be a genius, and the ones that expect you to be unable. So, if it's not noticeable at the first glance, I would recommend not to disclose to a possible employer. So Portugal, unfortunately, it's not the best.
I know that. I'm not looking for perfection either. Like the part that made me, I was in Portugal for 3 weeks, and I've met many friends there now who have become like family to me. There's so much empathy and intensity in Portugal that for the first time in my life, I didn't feel like I had to hold back. In Canada, people are very, very passive and quiet, and like it's mistaken as polite, but really it's conflict avoidance. People in this country don't like conflict, and they don't like to challenge anything or question things or any of that kind of stuff. And I'm a very inquisitive person who likes to challenge questions and go on debates. And I'm a very like passionate person who has like a lot of ideas and information and things that I love. And when I was in Portugal, I was not, for the first time, I was not made to feel like I need to pull back. I actually, for the first time in my life, I felt like I wasn't intense enough. Like everybody around me had so much passion too. And I'm also gay, and the gay community in Portugal is like really, really passionate and like loud and intense, and like I felt like I fit in. Like I wasn't trying to oppress myself to fit into these loud crowds. I could actually be myself and be passionate.
They're more intense than you.
Yeah, they're more intense than me. So I was like, oh my gosh, like this is home. I didn't feel like I had to change myself for the first time. And
did you talk to this friend about your intentions?
Yes, everybody knows.
Do you agree on this?
Nobody, no. A lot of people don't want me to die, but I can't help it. And I've wanted to die for a really long time. So I
at the same time, you're doing everything you can to stay alive.
I am. But it's not enough.
You really don't want to die.
I don't.
You're just tired. You're tired. You're very tired. Let us just think together. What can you do to recollect again your forces, because you're a strong person. Now you're tired. Even strong person get tired. What can you do in Canada to recollect your strength and keep on fighting?
It's not an option. I'm very stubborn, I'm at that point where there's nothing that's going to take me off of this track other than a ticket out of this country. There will be nothing that prevents me from killing myself. I have sold my car for nothing to get out of this country. All the money that I have quit my job, I have to get out of this country. I can't get another job here. I have no car. I was willing to sell my car to start over in a new country, but I have been stopped. Like, I have nothing left. I'm telling you, Sandra, like, I no matter what happens, but even before I had this appointment today, like, I have an appointment to go down to a place to pick up a helium tank. I am renting a car for New Year's Eve, and I'm going to take it to where I'm from, up north, and I'm going to do an exit bag, and I'm going to kill myself, and there's, like, I can't help it. There's nothing for me here except for oppression and isolation and abuse and people that tell me that I need to be somebody that I'm not, which is like a quiet person that's little perfect little person that doesn't, like, I can't be the person that they want me to be here. Okay? I can't act anymore. I'm too upset. I'm too angry. I have no. There's nothing in here in my body left to stay in this country. I used all of my strength to get out of it, and they stopped me. So this is the price that will be paid. I am sacrificing my life. I'm not. There's no other solution other than to get out of this country. I have done my effort. I have shown how hard that I have tried to get out of this country, and it's going to be well documented. Everything that I've done to try and get out of this country is going to be documented, and all the people that couldn't help me it'll be shown how hard I tried and how many people said no, that they couldn't help me. It's not going to be my fault.
No, you just called yourself stubborn. I have difficult spelling stubborn.
Like
I think you mentioned a characterism of autism. So it's not stubbornness, it's rigidity, cognitive inflexibility.
yes.
I'm afraid that you're holding on to an idea with this inflexibility that is typical with autism, and that it's going to cost your life. But emotionally, you don't want to die.
No, I do. I do. No, the only thing that will save my life is to get out of this country. I'm sorry. I don't care even. I don't even care where I end up. I don't even care.
I can say that I will talk to a doctor, okay? But can we think of anything else? Maybe I can talk with one of your friends in Portugal
About
helping you to stay alive.
no. I know myself. I know what my strength is. I know what I have endured already. I have been sent at least 30 letters from people that love me. They all know that I wanted to be euthanized. They all sent me letters about me and what they want from me, but they know that they can't change it because I'm not in a world that is made for me. It's
okay. So I will just talk with our psychiatrist. I'll try to see if he can see you on a video consultation like this, okay? And you please just research about can you send me the link explaining what are the exceptions,
I have it all. I have everything that I can send you, yes.
Okay. And please just try to, for me, I wouldn't, sorry about my English, it's very rusty. Try to solve this problem with the bank so you can pay him in advance. It's not a problem for me.
Is it a credit card? Can you take my credit card?
I don't know how to. I will ask people from my secretary if the number of the credit card it will be enough. I will see with them.
Okay.
Because I think the international bank account number would allow for a
I've done transfers before. I just didn't know what information was because it was in Portuguese, and the bank didn't know what number was what.
Okay,
but
so
I can.
When that says IBAN, International Bank Account Number, IBAN.
Okay.
Okay, but please send me the information about the
I'll send that right now.
Vaccines, and I will talk to our psychiatrist to see if he can see you as soon as possible. Okay.
Okay. Thank you.
Can I do anything else for you, Aaron? I really think it's a huge loss that you wouldn't try to rethought that, rethink.
That's all I've got.
You're very depressive right now. I don't think you're thinking really clearly. I'm afraid you're not thinking clearly. I'm sorry, I don't want to be unrespectful for you, but I'm
There's,
afraid you're not thinking clearly because you're really tired and depressed. I cannot think clearly when I'm tired and depressed. I do not make huge decisions, important decisions when I'm tired and depressed.
there's nothing that's going to, the only thing that I had to look forward to was to get out of this country and to get health care and to speak to a doctor that knows about autism and to start getting health care. And now I'm being held against my will by this fucking healthcare system that doesn't even care about me.
It was a huge setback. You have everything done. It was like a bomb in your hands. So.
I'm not doing this. This was not my decision. The government is killing me, and that's the way I see it.
Okay, so I will tell you by email if he can see you, if he can help you. I would, from my part, as a psychologist, I can only help by talking to you, trying for you to reconsider some decisions.
Thank you. I wish you the best. And I'll email you everything and see how it goes.
Thank you. We talk so.